Hi everyone, our project is designing an innovative device to detect and treat strokes in stroke survivors. I'm Colleen O'Malley.
I'm Hannah Rochelle.
I'm Annie Hughes.
And I'm Madison Stahl.
Today in America, 658,000 people have a stroke each year. Of those who survive a stroke, 1 in 4 are likely to have another stroke. Right now, symptoms of a stroke are identified by the acronym FAST, which stands for Face, Arms, Speech, and the Essence of Time. Strokes can be confirmed at a medical location, such as a hospital, using a CT scan or MRI. Our team has identified the need to detect and treat strokes within seconds.
Our solution to this problem is a continuous blood monitoring device that has sensors embedded in a smart stent located in the vertebral artery. The sensors measure various components of the blood and send this constant data to a receiver which is located on the right side of the chest underneath the collarbone. At certain stroke indicating thresholds, an antithrombotic drug would be delivered to the patient, and the device flow process starts with the constant monitoring of blood biomarkers as well as the blood flow rate.
Some of the biomarkers that have been proven to indicate ischemic stroke include the von Willebrand factor, MMP9, and D-dimer biomarkers.
The detection of a change which would indicate a potential stroke which would induce a clot in the blood. This would then trigger the delivery of an antithrombotic TPA drug. TPA stands for tissue plasminogen activator. The dosage of the drug is determined by the patient's weight, and up to 90 milligrams are sent to the patient through a primary bolus, and then the rest of the dosage is sent throughout the next hour. The TPA drug works by breaking down the fibrin in a blood clot, which restores the normal blood flow rate of the patient. All of this data is then sent to the receiver, which notifies emergency services as well as all the emergency contacts for the patient so that they can receive further care.
To talk through some of the costs and benefits of this device, as Annie mentioned, there's multiple parts that go together for this device, including the smart stent, the various sensors in it, and also the external receiving unit, which has the set amount of the antithrombotic drug in it. So all these parts added together make this a fairly costly device. One of the other costs of this device is that there is the cosmetic concern, as it is an external patch worn on the chest. So there's the concern that it could be seen by somebody, even though it is a fairly small patch about the size of a continuous glucose monitor that a diabetic patient would wear. As for this patch, there is also the concern of having to replace the adhesive that goes on to the patch to keep the external receiving unit in place. And then one other cost is that there is a risk of implantation when the smart stent is inserted in the patient. But to talk through some of the benefits of this device, as we mentioned, this is going to be used for stroke detection, but this device could also be used for detecting heart attack symptoms. And then also, the most important fact about this device is that it increases the valuable time for patients to seek medical attention when they have a stroke, because that can decrease the amount of brain damage that occurs.
So though our device is unlike any currently on the market, we have identified some competitors. The first being Cerebrotech Medical Systems, and they have a visor headgear type device called VIPS that detects stroke and is used by emergency responders and people in hospitals. Medtronic has a software that they're currently marketing called Viz.ai that uses artificial intelligence to detect stroke and send the images to the hospital workers. Neuroview Diagnostics is a small startup company that's in clinical trials for an AI facial weakness detector. One of the symptoms of stroke is weakness in the face, so this detector would detect that. And then lastly, the current most widely used way to treat stroke is with a CT or MRI scan, and multiple companies make these machines, and they're found in hospitals and stroke treatment centers. So our device is different from all of these in that it is both detective and therapeutic. None of these devices have both components, and that's where our device can come in and really shape the stroke therapy in the future. And so our device is very innovative and very different from anything currently on the market, and our device will help decrease the number of people affected by stroke in the future. So thank you. Any questions?